Here's a day in the life of a fourth-year medical student on an orthopedic surgery elective rotation. I'll start off the day with a healthy meal, change into clinic clothes, and then drive off through the ashy California sun to clinic. There I'll start interviewing patients and doing a physical exam. The head doctor will come in and do the same thing. Often we'll order imaging, and for many patients with issues like degenerative joint disease, we may offer them anti-inflammatory injection options like steroids or PRP injections. These can be done in areas like the knee joint, the shoulders, and various other areas. We do this with ultrasound guidance to make sure we hit the right area, and if patients don't respond to therapy after multiple attempts, we may offer them surgical options like a total knee replacement, as you can see here, or a total hip replacement, as you can see here. Then I got called in for an add-on surgery, so I quickly had a protein shake, ran over to the operating room, and to find out what happens next, like and comment down below for part 2. Day in the life of a medical student, part 2. So I ended up going up to the operating room, changing in the hospital scrubs, getting a bouffant cap, a beard cover, shoe covers, and boot covers, and then I ended up getting my personal protective equipment out, gloves, gowns, head visor, and all those things. I then scrubbed in, which is where you use special antibiotic soaps to wash from the tips of your fingers to your elbows, actually back into the operating room where the scrub tick helps you dry off and helps you don your gown and your PPE. Then the operation started. We basically cut open the guy's side, took out some infected tissue as well as some hardware, and replaced it with temporary pieces as well as antibiotics. Hopefully in a few weeks he'll come back infection free and receive some more permanent pieces. Then the operation was done, closed him up, and changed into clinic clothes for some more musculoskeletal issues in clinic. After that I was free, like for part 3. Day in the life of a medical student on orthopedic surgery, part 3. So after a long day in the clinic and the operating room, I finally headed off to the gym. I think it's important to take time out of each day to work on your mental and physical health, and lifting is a big part of that for me. The gym's finally opened up in California, so I was finally able to do a bunch of different exercises I hadn't been doing, and I usually focus on compound exercises, but I also throw in some isolation exercises as well. If you guys like me to go over different fitness and nutrition tips, I'll be happy to do that. Just leave a comment down below. After that, I went home and ate what's pretty much a standard meal for me, some kind of protein source, some vegetable source. Today I had some hamara on the side, but I'll mix it up. After that, I studied a little bit. I usually go over different pathologies that I see in clinic or in the operating room, and as well as some surgical cases. Then I ended off the day with some drawing. I did a little bit of sketching today of anatomy. After that, I headed off to bed and tried to get some sleep in before waking up the next day to do it all over again.